You know, the way that I conduct myself is how I was born, 2 ears and 1 mouth. And so looking forward to listening to what's happening on the front line of healthcare. Oftentimes we stand in this big building right down in Tallahassee and we think we know everything. We really don't know much at all. And so because of that, it's important that we're engaging stakeholders and engaging those who are truly on the front lines making things happen here for Floridians.
For example, critical, vulnerable patients with head and neck cancer, for example, who can't get a clearance in a timely manner after their surgery so that they can move into radiation.
The incentive has to be that you're going to have some reimbursement. These technology and innovations keep people out of the hospital, right, where they don't want them to go.
About credentialing, not just the initial credentialing process, but the ability to keep our providers credentialed.
When you're told to go to physical therapy 3 times a week for a month, right, that's an extra almost $500 bill that your family may or may not have been able to budget.
Nobody in Tallahassee really is a healthcare expert. Actually, we do have a few doctors there and nurses too. But my point is that if we don't hear this feedback from you, we don't necessarily know the areas that we need to be working on. We don't know how to make the right decisions to support the healthcare community.
It's so important that we get the insight of what's really happening on the ground. And once again, I wish I had a magic wand, you know, from Harry Potter and could fix all the problems with one wave. But these types of complicated issues do take years on years, but it's our goal to start working on them, right? And try to make it better and better so those that come after us, because we have term limits, those that come after us have an even further place to keep moving that needle. So we're looking forward to continued conversations like these, looking forward to staying engaged across every municipality and part of the state to make sure we can craft policy that, as you know, each region's different. And oftentimes we file bills thinking about just where we represent.